The president of the Medical Association of Trinidad and Tobago says government has its full support to achieve voluntary non-remunerated blood donations. In October last year, Health Minister Terence Deyalsingh indicated that his ministry was working on setting up a national altruistic, totally voluntary, non-remunerated blood donation program, which is in contrast to the current CHIT system. Dr. Bihari believes that this will improve the quality of blood being donated, which is much needed at this time.
Before COVID-19, approximately 22,000 pints of blood was donated annually, which is far below what is required. But in 2020, due to COVID-19, only around 9,000 pints of blood was donated. And while the demand for blood has decreased since the pandemic, President of the Medical Association of Trinidad and Tobago, Dr. Vishy Bihari, says the quota required is still not being met.
There is a significant reduction, and while there might also be a little bit of a decrease in the demand because of not much elective surgeries being done at the hospital, it still is not meeting the quota that we require as a country. PAHO has said that we require 65,000 pints per year. We have only been collecting 22,000 pints on average.
Dr. Bihari, who is also the Vice Chairman of Sewa International TT, believes there needs to be more of a push for individuals to donate blood. But he says in the long term, this has to be done without the CHIT system currently in place.
If you are under duress to give blood, then you are likely to say things or answer questions in the screening form that are not 100% correct. And that makes the blood unsafe for redistribution.
On average, Dr. Bihari notes that it costs over 1,000 TT dollars to dispose of blood that cannot be used, in addition to costs such as paying staff and setting up blood drives to collect blood. And while introducing a full voluntary system cannot happen overnight, Dr. Bihari is confident this could be achieved in the years to come.
We continue to do drives like this and build our database, encourage our volunteers to be true, honest, and accurate in giving information, and encouraging other persons to voluntarily donate, because we feel that we understand it cannot happen overnight, but we feel that once we continue to do our work and build that support, one day we can make blood donation in Trinidad and Tobago 100% voluntary.
Dr. Bihari was speaking to TTT News during Sewa TT's first blood drive for 2021 at the Diwali Nagar. He notes that the organization has been holding at least 4 blood drives annually for the past 8 years with the purpose of increasing this country's much-needed blood stock. Sonolala, TTT News.